Today we are going to discuss about the reproductive system of the male, which we have continued from the last lecture, and covering the glands in an uncircumcised penis is a loosely fitted pre-post or foreskin. This is an anatomical structure of the male. The root of the penis is the attached portion, proximal portion. It consists of bulb of the penis, the expanded portion of the base of the corpus sponginosum penis, and the crura of the penis. Singular is crus, resembling a leg. The two separated and tapered portion of the corona cavernosa penis. The bulb of the penis is attached to the inferior surface of the deep muscles of the perineum and is enclosed by the bulbosponginosum muscles, a muscles that adds ejaculation. To get it clear, you must go and see the pictures of this area of anatomy in your notes and books, what you have learned last semester, and then you will understand more easily. Each groove of the penis bends laterally away from the bulb of penis to attach to the scale and inferior pubic rami and is surrounded by the ischiocavernous muscles. The weight of the penis is supported by two large ligaments that are continuous with the fascia of penis. The fundiform ligaments arises from the inner part of the linea alba. Suspensory ligaments of the penis arises from the pubic symphysis. This is the front bone. So you have listened that how this organ is attached with different ligaments and muscles and bones and supported by them. Upon sexual stimulation, when there is a sexual stimulation, we call it visual or by touch, tactile, or if you listen something sex related, auditory, and if you smell something which stimulates your sexual desire, or imagine in your mind, you think about something. So sexual stimulation depends on your four perceptions. Five means olfactory or imagination. Olfactory is smell, because olfactory lobe is there above your nose at the caribriform plate. And when you smell something, it attached to the olfactory node, which is the cranial first nerve, and it will give you a sense of smell. So especially in animals, you have observed that they smell the females. Parasympathetic fibers from the sacral portion of spinal cord. From the spinal cord, some nerve fibers comes out, initiate and maintain an erectile. It will give an stimulation to the muscles for the mechanical function to give erection, enlargement and stiffening of the penis. And this happens with the parasympathetic system, which is the autonomic nervous system. The parasympathetic system fibers release and cause local production of the nitrous oxide. So due to the stimulation of parasympathetic system, which is autonomic nervous system, causes the release of nitric acid, production of nitric oxide. The nitric oxide causes smooth muscles in the wall of the arterioles supplying erectile tissue to relax. When there is a release of the nitrous oxide, the erectile tissue of the penis will relax, which allows these blood vessels to dilate. So the blood vessels are dilated. This in turn causes a large amount of the blood to enter the erectile tissue of the penis. Nitrous oxide also causes the smooth muscles within the erectile tissues to relax, resulting in widening of the blood sinuses. Means more blood will accumulate. The combination of increased blood flow and widening of the blood sinuses result in an erectile expansion of the blood sinuses, also compress the veins that drain the penis. The blood which is used in the erectile situation, then these deoxygenated blood will drain out from the veins of this area. The slowing of the blood outflow helps to maintain the erection. The term rapism refers to a persistent and usually painful erection of penis that does not involve sexual desire or excitation. In some people, in some persons, there is a continuous pain in the penis, and we call it rapism. Referred to the persistent and usually painful erection at the time of erection, they get pain of the penis. That does not involve sexual desire or excitation. Means without excitation, without desire. If there is erection of the penis, then there is a pain. The condition may last up to several hours and is accompanied by pain and tenderness. It results from the abnormalities of the blood vessels and nerves. This is due to the abnormality of the blood, means flowing blood which is coming to the penis, that is oxygenated, and which is going out of the penis, which is deoxygenated blood. As well as there is a defect in the nerve. Usually in response to medication used to produce erectile in male who otherwise cannot attain them. Means if there is a loss of libido or sexual desire is lost or the problem in the erection, then there are certain medicines available in the market and they use it. And with that, the circulation will disturb and cause the pain during erection. Other causes include a spinal cord disorder, if there is a defect in the spinal cord, leukemia, blood cancer, sickle cell any diseases, and means the shape of the RBCs has been changed, is sickly, or the pelvic tumor, if there is a tumor in the pelvis. Ejaculation to throw out the powerful release of the semen from the urethra to exterior. The sperms will come out with in a liquid which is known as semen released from the prostate, and it will throw out with full pressure. Is a sympathetic reflex coordinated by the lumbar portion of the spinal cord. This ejection or ejaculation, the coming out of the sperms with semen, is due to the sympathetic reflexes, which is the autonomic nervous system, and which have a supply from the lumbar portion of the spinal cord. As part of the reflex, the smooth muscles, sphincters, at the base of the urinary bladder closes, preventing urine from being expelled during ejaculation. So sympathetic system, what it do? It closes the sphincter of the urinary bladder, so urine cannot come with sperms. Otherwise, it will come mix and it will enter into the female, and that causes an infection. Closes, preventing urine from being expelled during ejaculation and semen from the entering the urinary bladder. So semen will not go into the urinary bladder, or sperms will not go into the urinary bladder, or urine cannot come in the urethra. Even before ejaculation occurs, peristaltic contraction in the epididymis, ductus vas deferens, seminal vesicles, ejaculated duct, and prostate propel semen into the penile portion of the urethra, spongy urethra. So before the ejaculation, there started peristalsis, means movement like a snake, and that peristalsis and contraction will started in epididymis, vas deferens, seminal vesicle, and ejaculated duct. as well as prostate propel semen. This semen comes out of the due to this peristalsis from the prostate into the penile portion, into the penis and urethra. Typically, this leads to emission and discharge of a small volume of the semen before ejaculation. So it's a natural phenomenon. Before coming, complete ejaculation, before ejaculation, the secretion, which is a viscous secretion, sticky secretion, comes out from the orifice of the penis on the glands, and it will give a lubrication to the male organ. So semen before ejaculation comes out. Emission may also occur during sleep, nocturnal emission. Sometimes it is happened without anything. While sleeping, this liquid semen comes out from the prostate, goes up urethra into the penis, and it will discharge in the dress we wear during night. The musculature of the penis, bulbospongionosum, ischiocavernosum, and superficial transverse superiorus muscles, which is supplied by the pudendal nerve, and contraction at ejaculation. It will happen in the ejaculation pudendal nerve, which give a nervous supply, sensory and motor. Motor supply will causes peristalsis and contraction. Once sexual stimulation of the penis has ended, the anterior supply, the erectile tissue of the penis, contract and the muscles within erectile tissues contract, making blood sinuses smaller. This relieves pressure on the veins supplying the penis and allow the blood to drain from them. Consequently, the penis returns to its flaccid, relaxed state. So now erection will reduce into the contraction. Now we discuss about the female reproductive system. The organ of the female reproductive system, figure is given in your book, include the ovaries. The female gonads, we call it. There are two ovaries, one on the left and one on the right. Fallopian tubes are there, which is a part of the uterus, right and left. Or oviduct from the ovum comes out from the ovary into the fallopian tube. The uterus, it's a pouch bag-like thing, which help for the offspring to convert into embryo and fetus. Then outer opening of the female is vagina. External organs, which are collectively called the vulva or pudendum. The mammal glands are considered part of the integumentary system, Indian skin system, and the female reproductive system. There is a gland which is known as mammal gland. Ovaries. The ovaries egg receptors, it will receive the eggs, which are the female gonads, are paired glands, one left and one right, that resembles unshelled almond in size and shape. They are homologous to testes. They are resembled with the testes. Here, homologous means that the two organs have the same embryonic origin. Means they produce from the same embryonic origin. And we know what is the embryonic origin, which is ectoderm, endoderm, and mesoderm. Ovaries produce gametes, secondary oocytes that develop into the mature ova after fertilization. The ovaries produce what? Gametes, ova, secondary oocytes that develop into mature ova, egg. After fertilization, and hormones include the progesterone and estrogen the female sex hormone. Inhibin and relaxin are also present. The ovaries, one on either side of the uterus, descend to the brim of the superior portion of the pelvis cavity during the third month of the development. Means this ovaries are developed at the age of 3 months of a baby. When it third month in the mother uterus, when the embryo is only 3 months. A series of ligaments hold there in position. The broad ligament of the uterus, actually uterus is like a, जिसे सुराई कहते हैं उस शक्ल की. So this is inverted. सुराई उल्टी कर दिया, यानी पेंदा ऊपर ले आए और मुंह नीचे की तरफ ले जाए. So what happened? A broad ligament of the uterus, see also, which is itself part of the parietal peritoneum. It comes from the parietal peritoneum. These are the ropes which hold that. उल्टी सुराई को पकड़ के रखते हैं, ये नीचे ना गिर जाए. गिर जाए तो क्या होता है? We call it prolapse. यूट्रस का prolapse कहलाता है. Part of the partial peritoneum, which is a part of the peritoneum. Peritoneum is a membrane which covers all the abdominal organs, attached to the ovaries by a double layer fold of perineum called the mesovarium. The ovaries ligament anchor, मतलब लटकाते हैं. The ovaries ligament anchor the ovaries to the uterus, and the suspensory ligaments attach them to the pelvic wall. Each ovary contains a hilum, the point of entrance and exit for blood vessels and nerves, along which the mesovarium is attached. Histology of the ovary. Each ovary consists of the following parts: the germinal epithelium. German means German sporus or the bud is a layer of the simple epithelium, locovidal or squamous, that covers the surface of the ovary. We now know that the term germinal epithelium in human is not accurate because it does not give rise to ovary. The name came about because at one time people believed that it did. We have since learned that cells that produce ovum arise from the yolk cells and migrate to the ovaries during embryonic development. The tunica albuginea is a whitish capsule of the dense, irregular connective tissue located immediately deep to the germs and epithelium. The ovarian cortex, this upper part, is a region just deep to the tunica albuginea. It consists of the ovarian follicle, described shortly, surrounded by the dense, irregular connective tissues that contain collagens, fiber, and fibroblast-like cells called the stromal cells. The ovarian medulla is deep to the ovarian cortex. The border between the cortex and the medulla is indistinct, but the medulla consists of more loosely arranged connective tissue and contains blood vessels, lymphatic vessels, and nerves. So today, whatever we have discussed, you should go through this. You must have a physiology book and anatomy book in your home. And when you keep the figure in front of you, you will find more information, and you will learn more better because theory is there. I have not put those figures in the slides because when I try to send it, load it on the YouTube, the file is very heavy and it will be a problem for me. Right? So try to go through the book. If you have any query, you can call me. We have a discussion on WhatsApp, right? So because you people are busy in your labs, that's why I am just recording these slides. If you have any query, you can ask anytime. Thank you very much. So I have to stop over here.